Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. The spinal tract decussations. So the first one is, so it is a decussations. So the first one here, it includes the, let's look at the names and the decussations. The first one is the gracile fasciculus. So before we move to that, let's look at the ascending tracts. The ascending tracts in a whole, it includes the dorsal column. The dorsal column, it includes a fine touch, vibrations, as well as the joint positions. Then it includes the fasciculus gracilis as the cuneatus. Next is there is also presence of the dorsal spinocerebellar. Then comes the ventral, the spinocerebellar. Then comes the spinosalivary, spino-olivary, and the spinotector. Then comes the ventral spinothalamic. This comes under the anterolateral. So anterolateral pathway, what does it include? So this includes the ventral spinothalamic and the lateral spinal thalamic. So here it is concerned with the pain, it is concerned with the thermal sensations, as well as the crude touch, pressure, the tickle, and the itch sensations, and the sexual sensations. So all this is brought by the anterolateral pathway. Next is we look at the descending pathway. So descending pathway, it includes the lateral corticospinal and also the rubrospinal. So lateral cortical and the rubrospinal. Then the lateral tegmental lateral reticulospinal tract. Then comes the vestibulospinal tract, the ventral reticulospinal tract, as well as the tectospinal tract, and the ventral corticospinal tract. Now let's look at the names and the decussations. So first is the gracilis fasciculus. So gracilis fasciculus is present in the medulla, and the cuneatus fasciculus is also in the medulla. Then what do you see in the spinal cord? The spinal cord decussations, it includes the spinothalamic and the spinoreticula. Spinothalamic and the spinoreticula. Then comes the posterospinocerebellar, and next is the anterior spinocerebellar. Anterior spinocerebellar decussation takes place in the spinal cord. Next is we look at the other one, that is the lateral corticospinal. This includes the decussation that is in the medulla. Then comes the anterior corticospinal. Anterior corticospinal is present in the spinal cord. So lateral corticospinal is in the medulla, the anterocorticospinal. So AC spinal is in the spinal cord. Now what about the tectospinal? Tectospinal takes place in the midbrain. Then comes the decussation where there is none. It includes the lateral reticular, the medial, and the lateral vestibulospinal. So all these includes none. Then comes the medial vestibulospinal. So medial vestibulospinal decussation takes place in the medulla, that is nothing but the C fibers. To learn and grow daily like this, please do subscribe.